Hello, my name is Reina Velasco, and my group members are Riley Erskine, Jason Hickox, and Emily Garcia. Welcome to this presentation on our educational curriculum titled STI-Smart College Edition, which targets sexually transmitted infections among college students.
The curriculum's goal is to improve and promote sexual health among students at CSULB. There are 4 unit topics, including types of sexually transmitted infections, risk factors, prevention methods, and treatments and resources. The sample learning opportunity presented today will focus on Unit 1.
Let's begin with an overview of today's lesson titled STI Safari. Unit 1 focuses on the different types of sexually transmitted infections. By the end of this unit, the learner will be able to analyze and differentiate between various STIs. And to achieve the Unit 1 objective, we'll focus on the 2 enabling objectives within the cognitive domain and knowledge level. Following instruction, the learner will be able to list the main modes of transmission for STIs and a list of symptoms of 2 STIs.
Before we begin the STI Safari, please take out an electronic device, navigate to kahoot.it, and enter the code displayed on the screen. This Kahoot pretest will assess your understanding of modes of transmission and symptoms of sexually transmitted infections. As we progress through the Kahoot, please take note of the number of questions you get correct. Sexually transmitted infections are diseases caused by infection with certain bacteria, viruses, or other microorganisms. There are 3 different modes of transmissions for STIs, including sexual intercourse, mother to child, and blood contact. STIs are spread more frequently through oral, vaginal, and anal intercourse. When individuals do not use protection, such as a condom, they are at a greater risk for acquiring an STI through an infected individual's semen, vaginal fluid, or other bodily fluids. STIs such as gonorrhea, chlamydia, HIV, and syphilis can also be passed from mother to infant through the placenta, birth canal, or contact with open sores, and it can result in serious complications for the infant. Lastly, STIs can be transmitted through blood to blood contact. This can occur by sharing syringes or equipment to inject drugs, body piercing equipment, or tattooing needles.
Symptoms are something that a person feels or experiences that may indicate the presence of a condition. The first sexually transmitted infection we will discuss is chlamydia, also known as the silent infection due to the prevalence of unnoticeable symptoms. Chlamydia is caused by the bacterium Chlamydia trachomatis through sexual intercourse, and it is one of the most common bacterial STIs. Females may experience vaginal itching, burning, painful or frequent urination, or vaginal discharge, which can present itself with discoloration or a strong odor. Males can also experience painful urination and discharge from the penis, but the consistency will present itself differently than with a female. And both males and females can experience no symptoms at all.
Gonorrhea is an infection caused by the bacteria Neisseria gonorrhoeae. It infects the muscle membranes of the reproductive tract. While the infection can be asymptomatic in both males and females, it can also cause uncomfortable symptoms. Females may experience lower abdominal pain, painful urination, white or yellow discharge. Similarly, males may experience watery or mucus-like penital discharge and inflammation of the testicles along with pain.
Syphilis is an infection caused by the bacterium Treponema pallidum. It is spread through direct contact with a canker. Because syphilis progresses through multiple stages, its clinical symptoms manifest differently throughout its natural history of disease. The primary stage usually presents with a single canker or sore at the infection site that is typically painless, firm, and round. Without treatment, the canker will last 3 to 6 weeks and heal on its own. During the secondary stage, skin rashes and mucous membrane lesions in the mouth or genitals will appear. Rashes usually do not itch and may present as rough red spots on the palms of the hands and feet. Raised gray or white lesions can also develop in the mouth, underarms, or groin. Additional symptoms may include fever, sore throat, headaches and muscle aches, fatigue, and swollen lymph nodes. Symptoms may recur within the year and progress to latent syphilis. During this stage, manifestations of primary and secondary syphilis resolve. Symptoms are not detected despite the infection remaining in the body, and the stage may last for years. Tertiary syphilis can appear 10 to 30 years after initial infection and may affect various organ systems, including the nervous, visual, and auditory systems. Symptoms vary depending on the symptom affected and will be fatal without treatment. Next, 2 sexually transmitted infections discussed on this slide are HPV and hepatitis B. Human papillomavirus is a common viral infection with over 100 different strains. Of these, 40 infect the genital area, but don't pose serious health risks. Genital HPV is spread through skin-to-skin contact during sexual intercourse, and while most infections are asymptomatic, some infected individuals may experience genitalia warts or itching. Hepatitis B is a viral infection spread through bodily fluids such as in childbirth, sexual contact, and sharing needles. While some newly infected individuals may not experience symptoms, others can experience fever, fatigue, loss of appetite, or nausea and vomiting. Similarly, for some, hepatitis B can be a short-term illness, and for others, it can be long-term and lead to more serious conditions such as liver disease. Individuals with chronic hepatitis B can experience symptoms associated with liver disease, including jaundice, dark urine, and inflammation of the arms and legs due to increased fluids in that area.
Final STI we will discuss is human immunodeficiency virus, HIV, and acquired immunodeficiency syndrome, AIDS. HIV is transmitted through various body fluids such as blood, semen, preseminal fluid, rectal fluids, vaginal fluids, and breast milk. When not treated, the virus will progress through 3 stages. During stage 1, some may be asymptomatic while others may experience flu-like symptoms, including fever, headache, rash, or sore throat. During stage 2, infected individuals may not experience any symptoms, but the virus remains active in the body. If the individual progresses to stage 3, which is recognized as AIDS, they may experience rapid weight loss, recurring fever, extreme fatigue, prolonged swelling of the lymph glands, and reddish brown or pink blotches on the skin or inside the facial orifices.
Now that we've gone over the modes of transmission and symptoms of STI, it is time to complete the Kahoot post-test. As we did at the beginning, please take out an electronic device, navigate to kahoot.it, and enter the code display on the screen. While completing the Kahoot, please remember to take note of the number of questions you get correct. Once completed, we'll go over the outcome as a group.
This marks the end of today's lesson. If you have any questions, please feel free to ask. As you take a second to reflect on the information, I'd like to remind you that understanding sexually transmitted infections isn't just about acquiring knowledge, it's about protecting our health and our well-being. By recognizing the modes of transmission and symptoms of STIs, we empower ourselves to make informed decisions and take proactive steps to protect ourselves and others. Remember, sexual health is a crucial aspect of overall well being, and the knowledge gained in the STI Safari equips us to navigate this terrain confidently. And lastly, here are the references if you would like to seek further information on today's material. Thank you for your participation.